let's go ahead and get started. So welcome everyone to our December Digital Medicine Society webinar. Today I am really excited to welcome two tremendous presenters and two strong and experienced moderators to guide us through a discussion of Xcertia's mHealth app guidelines. For folks who don't know, and we will learn more about them today, they were released this summer after a period of really hard and interdisciplinary work. What I will do is I'll hand over to Greg Licolai in just a moment to introduce himself and also his fellow experts for today's webinar. Before we dive in, let me just run through a couple of housekeeping notes. I'm thrilled that our experts today have taken a more sort of panel discussion approach. They will walk through a number of slides. They will have a discussion sort of at a high level among themselves. For folks on the line, we do welcome questions, and there will be some Q&A time set aside at the end. Please feel free to type your questions into the chat box as we go. And when we come to the Q&A session, Greg, who is moderating, will call on you, will get you all unmuted and allow you to ask your questions directly to the team. And just so everyone knows and is aware, I want to disclose that we are recording today. We always have a good number of people listening into these discussions after the fact as well. So with that, Natalie, Michael, and Michael, both of you, and Greg, thank you so much for being here. And Greg, let me turn it over to you.
Terrific. Thank you very much, Jen, for hosting this, and thank you very much for asking me to participate. Just a word about my background. I'm the co-director of the Yale Center for Digital Health. I teach classes on innovation in sustainable healthcare at Yale School of Management. I do have an MD from Yale, and I also, we write and do research and promote digital health. I'm also part of the advisory group, CTTI, the Clinical Transformation Initiative that's co-sponsored by the FDA. When I'm not teaching, I'm the Chief Medical Officer of a large public company called PRA Health. So enough about me. Let's talk about today's session. Is about the mHealth app guidelines that has been put together by Xcertia. So what we'd like to do is start with some foundational definitions about who Xcertia is and where these guidelines come from. And then we'll get into some more details around what the actual guidelines are and recommendations. But before we do that, let me ask each of our presenters and my co-moderator to introduce themselves. So let me start with my co-moderator, Michael Hodgkins.
Yeah, hi, thank you very much, Greg. And thank you, Jen, for making this opportunity available. I am Michael Hodgkins. My day job is a Chief Medical Information Officer for the American Medical Association. The AMA was one of 4 founding groups of Xcertia about 3 years ago, and I've served as chairman of the board of directors of Xcertia since the beginning.
Excellent, thank you. Natalie, please, let's jump to you and please introduce yourself.
Sure. This is Natalie Apps. I'm currently the head of human factors engineering at Genentech, which is a large biotech company in the San Francisco Bay Area. I recently joined Genentech back in April, and I'm leading their human factors team now. Before then, I worked in human factors consulting for about 7 years, working with different medical device companies, pharmaceutical companies, app developers to evaluate their products and make sure that they're safe and usable for the target populations. And I have a formal education in human factors and ergonomics from the University of Wisconsin-Madison. And my association with Xcertia is that I was the chair of the Usability Working Group.
Excellent. Thank you. Let's jump to Michael Kerwin. Could you please introduce yourself?
Thank you. Yeah, hopefully you can hear me okay.
Yep.
Okay, thank you. So I am formerly HIMSS. I used to work with HIMSS with several, parts of HIMSS, Personal Connected Health Alliance. And this is how I got involved with Xcertia. I've since left HIMSS and now running my own company, and my own company's dealing with organizations that are developing apps in the medical space. I also am a co-chair of the IEEE Personal Health Devices Work Group, and then also a Bluetooth qualification consultant. So I help companies specifically in the, let's say, the health, medical, and fitness space, connect their Bluetooth stuff together, So this is how I've become very acquainted, I think, with the Xcertia Guidelines and how I help educate these companies to learn more about it.
Excellent, excellent. And we have one more person, Dave Crosby. Could you also please introduce yourself?
Sure, yes, thanks, Greg. Dave Crosby here. I am the Managing Director of Xcertia. I'm with one of the 4 founding organizations, DHX Group, and have been involved with these guidelines back prior to the formation of Xcertia, when the guidelines were one of several assets we acquired from Haptique when it was sold off by Greater New York Hospital Association. So I've been close to these things for a number of years and look forward to today's discussion.
Excellent, excellent. So we have a terrific panel with a lot of depth of knowledge in this particular area. All right, let's move on and define objectives for this meeting, for this presentation. And also, while we're at it, let's talk about maybe some background for Xcertia. So just to get us started, the objectives for this session are to provide perspectives, lessons learned, and key insights from the Xcertia process of developing guidelines for mobile health applications, as well as explore future opportunities for deploying these guidelines in the market. But just to make sure that we're all founded on the same page here, I'm going to ask Michael Hodgkins and David Crosby just to give a couple of bullet backgrounds about Xcertia and what it does, and then your reflections on this guideline process to get us as an introduction.
Okay, well, thank you, Greg. This is Michael Hodgkins. As alluded to, Xcertia began about 3 years ago. There were 4 founding organizations: AMA, American Heart Association, Dave's organization, and HIMSS, and we shared sort of a common interest in the mHealth app space, which I think most people at the time tended to describe as the Wild West. It was really a buyer beware situation, and we felt that clinical professionals and consumers and patients needed better guidance as to what they should expect from an mHealth app that they might choose to rely on, whether for health and wellness or for chronic disease management. We also thought that the developer community needed to understand what the expectations were from the clinical professional and consumer patient communities in terms of what would constitute a quality app. And as Dave mentioned, at the start, we had a set of guidelines that had been developed by a Blue Ribbon Commission that DHX had acquired from Haptique. Some of you may recall the story of Haptique. Started out with great ambition, did, I think, a very good job of creating basic guidelines, but then failed in execution in terms of using those guidelines in a certification program. And we thought it was very important to have a comprehensive set of guidelines that any one a set of guidelines, for instance, dealing with clinical content, clinical evidence, or usability, while necessary, was not sufficient, and that privacy, security, interoperability were of equal importance. So at the formation, there were the 4 founders. We very quickly added a board of directors that included the organizations that you see on slide 4. And that included representation from FDA and ONC as non-voting members of the board so that they could fully participate. But I'll stop there, and I don't know, Dave, if you wanted to add anything, or if there was any specific question from the participants, or Greg, you had something you wanted to learn more about.
This is very helpful. Dave, do you have any perspective really just about the background of Xcertia? And then maybe we'll move into the process that started these guidelines.
No, I think Michael summed it up pretty well. I'll reserve my comments, Greg, for more of the process that we went through.
Great, great.
Actually, Greg, let me quickly add that at formation, Xcertia decided that it wanted to be a content creator and not a certifying body. We thought it was important to separate those functions. And we also, from the beginning, wanted to make the guidelines publicly available. So Xcertia has been a membership organization. The guidelines are freely accessible on the Xcertia website. We don't engage in any licensing arrangements or what have you.
Understood. Understood. Yeah. So markets that are moving quickly and emerging, like mHealth, need a certain level of collaboration to developing rules, guidelines, etc. And to that end, Xcertia is right in the middle of a number of important organizations such as the AMA and American Heart to serve as a catalyst. And as a catalyst, it has to understand what issues exist in the marketplace and understand the kind of the requests of its shareholders. So to that end, I understand that there had been a survey conducted. Dave, maybe I can ask you to talk about how that survey was conducted and what were the objectives and what were some of the findings.
Okay, great. So one of the things we did, Greg, back in 2018, early in the year, we wanted to get a sense from the market in terms of, as we were now moving from a backdrop, we were now moving from a position of getting the first version under the Xcertia umbrella, getting the guidelines completed. But we wanted to get some perspective of, as we were now going to move away from an internal focus, which was developing the guidelines, to an external focus in terms of how do we now bring these guidelines into the market so they can add additional value to this whole process of determining which mobile health applications to use and for what reasons. And so we conducted, it was a relatively limited survey. We went to our members. We have over 40 member groups. We went to our work group participants, understanding that a number of our participants were not members. And we also surveyed the Personal Connected Health Alliance membership, just again to get a sense of what taste and feel does the market have for these guidelines, who should be doing them, and then how they should be implemented. So if you want to go to the next slide, I'll just give a quick top line. I think it has some relevance here for what our partners at DiMe are doing and at other places. If some of the questions focused on sort of the value of the guidelines, and I think most people felt that if you're going to improve adoption in the mHealth space, you do need to have some guidelines, some basis for people to make a decision. If you looked at who should be doing these things, again, these were pretty significant numbers in terms of majority. felt that that a nonprofit organization is the right resource. They also felt that some sort of mark or process, something that took the exercise of going through the process and figuring out the apps, which apps are good for me or my organization or my patients, that somebody did that work already was important. And some of the other things here I think are pretty self-evident as you look through these. The critical thing here that I think we took away was that we were on the right track in terms of who should be doing these things. We were on the right track in believing that getting these things incorporated into the market would help possibly drive up adoption and use. But the interesting thing is the second to last bullet point is that, and I think we knew this intuitively, but the data proved it, is that just creating guidelines, having what I would call a static document, if you will, is not going to drive anything. It's not going to create change in the marketplace. It's not going to create care professionals or consumers to adopt or use these things or have greater confidence that there needed to be transferred from that static document to some sort of a dynamic process. So overall, I think the survey results said we're on the right track, and I think it also reinforced that other folks like DiMe and others that are in this space that we are moving in a direction that the market is saying, this is the right way to go.
Yeah, thank you for that summary. It's fascinating if we reflect on the fact that mobile health is a highly entrepreneurial and fast-moving industry. Yet, when you survey the participants in that industry, who tend to be, and I say this very positively, sort of free-thinking entrepreneurs, that they overwhelmingly felt that the presence of guidelines and regulation of those guidelines is important. And of course, it reminds us of the importance of developing standards which really are in the best need of public safety and public good, which actually increases reliability and increases adoption. Michael Hodgkins, do you have any other comments on the survey before we start talking about the process?
No, let's go ahead, Greg.
Okay, great. So let's jump into the approach that was used for the development process, and so I know a number of the people here were involved in that. But I don't know if Dave, maybe you're the best one to kind of outline the approach, and then we can go to other people in the group.
Yeah, what I'll do, thanks, Greg. What I'll do is I'll provide sort of a high-level look at how we try to wrestle with this issue. Okay, if you think about when we took over the guidelines with the first intention of the organization being to update these guidelines to reflect today's thinking and today's market. That was a mandate and issue from the board. That was really the only thing we had. We had a set of guidelines that had been developed. We had a mandate from the board, but then we had to figure out how we were going to do this. And the challenges we faced there were multiple challenges. One is that from a broad stroke sort of organizational perspective, we knew we needed to involve a large and diverse set of points of views and perspectives, work experience, personal experience. One of the shortcomings we felt that some of the existing guidelines had is they were written from one perspective, whether the perspective of an app developer or a provider. Not to say these are right or wrong, but I think the feedback we have is it needs to be more reflective of the broader industry thinking. And so our first challenge was we have these 4, and it evolved to 5 sections within the guidelines, over 145 criteria contained within those 5 sections. We had over 50 people who were forming the work groups from different backgrounds, different organizations, different schedules, different experiences. And we had no mandate at that time from the board in terms of where do we want to take these guidelines? What should be our first sort of mission 1 with the first evolution of the guidelines under the Xcertia name. And so the first step, what we did originally before the work groups got going is we spent a decent amount of time developing a charter for each work group that defined the scope and the purpose, the types of people we wanted in each of those work groups in terms of their background experiences and so forth. We laid out those areas that we were going to focus in on and we also laid out those areas that we were not going to focus in on. So for example, if you look at the content work charter, it was focused on the accuracy of the content in there and the transparency of that information. It was not focused on does the content lead to a positive clinical outcome. That was a conscious decision that was made to not tackle in this go around. And so each of the work groups had those challenges. And so the format that we brought in, the structure that we brought in, was the development of the charters that each work group had. Those charters were approved by our board of directors so that there was very specific marching orders for each group in terms of providing a framework or a box to work within. And then it was an issue of getting the right people in place based upon the criteria and the charters, finding the right work group leaders, which was probably the most important thing we did in the process. And like I say, we got for the 5 groups we had excellent subject matter experts for each of those, and they were also really good at running groups, which was critical. And then we had a very strict published schedule that we tried to keep to. And I think those were the, to set the stage, there was a lot of sort of heavy lifting and alignment that had to take place before the work groups could come together. Otherwise, as I said, it was going to be an exercise of herding cats around the room. We had to have that definition, and we had to have the board support up front. And so with that as a backdrop, that's what then led to the initiation of the groups, the appointment of the work group leaders, and then the actual work taking place.
Yeah, that's very helpful. And with the being able to use guidelines effectively makes one an expert in their team, in their group. And you had 5 groups, 5 chairs, and 5 sections. And so once again, those sections are security, content, operability, usability, and privacy. Let's move on to actually using existing knowledge and using outside guidelines and how that informed helping to develop or update the current guidelines. So maybe we can switch to Natalie and Michael, or other Michael, to talk a little bit about the process and what additional resources you brought in to inform this work.
Sure, I can go ahead and take this one right away. This is Natalie. So something that was kind of unique about what occurred with the usability guidelines is that it was the only section where we didn't really have information to start with. So when I came on as the chair of the working group, it was mentioned before that there had been a draft document of the guidelines that had already been developed. However, that we found that a lot of the information that we had in the usability section was more along the lines of operability. And we felt that that was a really distinct category of guidelines from usability. So the thinking was that we have operability, we have what the app can do, what features exist, how it operates, and then we have how it operates once you put user interaction into the mix. And so we made kind of a collective decision that it would be probably work out the best to separate those 2 topics and have operability and usability separate. So it was an interesting challenge for the usability work group because most of the content that had already been generated was specific to operability, and so we were a little bit at more of a starting point, starting with a clean slate. So for us, I think looking at existing documents that were out there was pretty critical to our process. So what we did is we kind of researched. So we had a really great group of people, lots of different backgrounds, lots of people with human factors and usability experience, who have used resources, human factors literature, things like that, are very familiar with the concepts and principles of usability and human factors. And then we're also able to find some other sets of guidelines like Apple's design guidelines, Android's design guidelines, things like that, looking at what resources are already out there that are being used so we can make sure that we take some of those things into account and we're not reinventing the wheel. And one thing that was, I think, unique to the Usability Work Group as well is that we engaged some students at University of Arizona to help us out with that research effort. So one of the work group members, Professor Russ Brannigan at University of Arizona, teaches courses in usability and human factors. And so we've got some students on board, and they were able to help us out with researching what's out there, or kind of consolidating the information for us and giving us really a good basis of what is the literature saying, what are, informal guidelines and documents out there saying, and also what is being said from a regulatory standpoint, which a lot of people on the work group team were already very familiar with. And that gave us a really good starting point to decide what was appropriate to include in the set of usability guidelines that we were generating.
That's very helpful. That's very helpful. Could you maybe talk a little bit about usability in general? And so when you look at, you're an expert in human factors. So when you look at usability, what are some of the best practices you look for, Natalie?
In terms of the attributes of an app?
Yeah, precisely.
Sure. So, I mean, there's, from a usability perspective, there are a variety of principles that we apply to really any product design. And, well, I guess you're kind of touching on what was a challenge with this as well, is taking all of that information and consolidating it to what's important. But I guess one thing that the team did to help consolidate things was to categorize some of this information into higher level categories and then go from there. And that's where really like the principles of usability came in. So I know one of our major categories was visual design, so that we know that how things are laid out on a screen is going to influence, whether someone navigates in the right way. Is it easy for them to find things, things like that. I guess I would also say that one of the backbones of the usability principles are come from a definition from Jacob Nielsen, who's big usability guy, cited very often, and looking at the 5 quality components of usability. And of course, at this very moment, they're like escaping me, but making things memorable, making things easy to understand, reducing the probability for error, and ensuring that users are satisfied with the product are all very important components. And so we kind of leaned on those, as well as some other human factors principles, wanting to make sure that the things we focused on were, ease of use, efficiency, just general avoiding confusion for the end users, and making things as simple as possible so people would want to return and continue to use the app.
Great, that's very helpful. That's very helpful. At this point, we haven't heard from Michael. That is from from Michael Corwin. Do you have comments on at this point we're talking about developing the guidelines, and then the existing set of guidelines, as well as reminders of how to deploy. Do you have any comments on that before we get into the insights and the findings themselves?
Yeah, no, I do. And, I sat across probably three of the 4 or 5 groups, actually, and I occasionally even attended some of the other groups. And at the time, I was working with Personal Connected Health Alliance. And so my role was really kind of evaluate, see how we could help, and potentially even consider this as something we would recognize within the Continua design guidelines. So these are end-to-end sort of remote patient monitoring guidelines. Now those guidelines exist, but inside of IHE, in integrating the healthcare enterprise. However, I think my real interest is really more aligned with what David said earlier. You want to get the right people together and who have diverse points of view. And the idea in my mind was really to create a set of best practices. And so I talked to other organizations in Europe and that were trying to do this, and other interested individuals over the years, I didn't know a whole lot about haptique, but you know, this was really derived from that, and I think they were trying, you know, Xcertia was trying to go in potentially a different direction and to get the interest of a lot of different organizations. But again, since, you know, I've been out on my own now working with companies, I think I've referenced these things in every organizations that are doing apps for, you know, health or in hospitals, things like that, such as wayfinding, and then combining, you know, other features of what their services and products into a specific app that can do many different things. And of course, it has to embrace, you know, the privacy and security. Usability is very important. I look at it as SCOOP, so security, content, operability, usability, and privacy, and this is how I explain that to people. But my perspective in the development, while I sat on these groups in my reviews of the actual guidelines, is really kind of look at it and see, you know, if I were a developer, how would I validate that I actually did the 145 sets of criteria that David mentioned before. And so really I wanted to put a little bit of a testability perspective on it. Not that we were going to take it through certification or anything, but to make it something that, you know, you have clear metrics for. Second to that is, you know, continue as an international organization, and if we were going to recognize the Xcertia guidelines through, you know, the continuing guidelines or some other fashion through Personal Connected Health Alliance, you know, we wanted it to also have a international perspective. And then in that, I think the group, especially in the privacy group, when they started talking about, okay, at the same time GDPR was coming through, and several of the United States had built their own set of privacy guidelines and things. And so a lot of these things are referenced within the Xcertia guidelines. And then last, even though, you know, everything is moving so quickly, you know, the way the technology is developing in AI and machine learning, VR, you name it, you know, it's very difficult to write a set of guidelines that, you know, will always make sense. So it's really kind of looking at it through a you know, 100-year lens, if you will, you know, something that, you know, could live on. And I think what we have is a pretty good set of guidelines that you can hand to any organization that is developing an app. At least they are level set to what of the things that they should look at. And as I think David said it earlier, you become an expert after you've done this once or twice, and then all of a sudden this standard, this set of guidelines becomes sort of the benchmark that it currently doesn't exist or didn't exist before them.
Terrific, terrific. Very, very helpful. Very helpful. Any other comments? Because now I would like to move on to, you know, the actual heart of the discussion here, which is what are the recommendations and what are some of the key findings from you know, from the development team. And you know, maybe as we're talking about this, I'll open up to anybody in the group who you know cares to jump in. You know, maybe we can start with what were the key insights that you found, and what were some of the key challenges that were identified that needed to be needed to be made aware of in order to proceed. You know, maybe let's start with the challenges first, and then we can move on to the insights and conclusions.
Okay. Hey, Greg, it's Dave Crosby. I'll chime in on some of the ones that I had observed. I think one of the big challenges throughout, even though we defined purpose and scope up front, was to stay focused within that purpose and scope. Because as you can imagine, as you start to get into this, And, you know, there's hundreds and hundreds of different rabbit holes you can run down on any one of these criteria. But I think our first, you know, the mandate from the board, I think on this first go round, which we had to constantly keep, I think, bringing folks back to, is that, you know, let's find things that are in the guidelines that just don't make any sense anymore, that shouldn't be in there. Let's find things that aren't in there that should be, and let's find those things that are in there but need to be updated based upon whatever's going on in the market technically and whatever. So I think one of the big lessons learned for us, at least for me personally, was that we had to sort of keep focused on that, but then at the same time in a parking lot sort of a fashion, all the things that we would want to get to in the next generation of the guidelines, because the intention is to update them every year to keep them relevant and timely. So that was one big takeaway. The other big takeaway for me was that while you have 5 silos of activity here, you know, within their 5 respective areas of the guidelines, it was fundamentally critical that at some point in time in this process, all those guidelines needed to be cross-pollinated with one another. And that primarily was for 2 reasons. One, this, you know, a lot of these things are not purely black and white. And we had discussions about, well, is this, you know, this is covered in content, but it's also sort of covered in usability, some of these criteria. If you look at the guidelines, you'll see where some of those overlaps are. And so it was critical that we did this at the end of the process. We brought the work group leaders back together and said, okay, your section's done. Here's the other ones. Now let's look at these and let's understand your section from these other sections as well, so that, because the document exists as one whole document. It doesn't exist as 5 documents, right? And so there had to be consistency across the board in terms of ultimately where did we place some of these criteria, and then if they did appear in multiple places, maybe worded differently, but the intention was the same, that we had to make sure that we were saying the same thing about an issue that appeared in content that also appeared in usability. So I think for me, those were 2 of the big takeaways in terms of you know, what I learned from this process.
And I'll go ahead and add to that. So Dave made a comment about going down a rabbit hole, and I think that is a really important challenge that we had here was, you know, wanting to provide enough detail so that these guidelines were useful, but not so much that the concepts that we are talking about couldn't be universally applied. So we know that there are tons of different types of medical apps out there, right? Some of them are regulated, some of them are not, some of them have safety critical implications, some are just used for general tracking. You know, there's all sorts of things out there, and we really had to be conscious of not getting bogged down in you know, designing or making recommendations towards a specific type of app, but then we also didn't want to, you know, write guideline after guideline after guideline to try and cover each type of app. We wanted each guideline to be applicable to any app that you could think of. And so it was challenging trying to figure out not only what is that stopping point where we don't go down a rabbit hole of having 100 different guidelines about the visual design of the interface, but providing the detail that would actually, you know, be helpful and not be so vague that it wasn't useful. And I think that was really important, is identifying how can these be useful to everyone and not go down the rabbit hole of becoming overwhelming to the point where no one would even want to read through, you know, all of these pages and pages of minutia. So I would definitely second that as a challenge.
Very, very helpful. Thank you. Any other comments about you know, things that you noticed out at the beginning of the process that needed to be addressed?
I have one other, and it sort of echoes what Natalie was saying there. But one of the challenges that kept coming up as the groups were updating the guidelines, Greg, was who are we writing these for? Are these guidelines for app developers? Are these guidelines for healthcare providers? Are they for consumers? Because you could write it in a different way. And I think our initial, as Natalie said, the initial version was designed to be, serve as a more macro purpose that everybody could read and learn something from. And that was, I think, a constant challenge for the groups to sort of bring themselves back to saying, okay, how do we write this, as Natalie said, for everybody, as opposed to, because an app developer version may look a lot different than what we'd write for a consumer to evaluate an app, right? So I think that was a challenge.
Mm-hmm. Yeah, I definitely agree with that as well. We definitely wanted things to be universal. I do think that one of the benefits of having such a, I guess to sort of jump over to insights, having such a diverse team of contributors is that we could kind of identify, if we're writing something in such a way that's only understandable for someone with a usability expertise, does the clinical person understand that language, and vice versa. We also had someone who was a little bit more on the technical side of app development and was able to identify, whether certain things that we were saying made sense or not, and if we're using the correct terminology. And so I think that that's a really good point about trying to translate this for different audiences and make it universal, but also kind of keep some of that technical language in there to be credible. So using some human factors terminology that would be understandable to, most people, to make sure that it didn't sound, like it was written by someone who didn't have any background in the field at all. So it was a bit of a balancing act.
Terrific. Good. Okay. Very, very helpful. Very, very useful to understand the context and understand the challenges. Let me do this. I'm going to ask each of you to give thoughts about the following. What did you find as the key outcomes from this process, and what did you find as takeaways in the area that you were involved in within formulating these guidelines? So let's kind of go around the circle here and get everybody's input. Does anybody care to go first? If not, maybe I can jump to Michael Hodgkins to start.
Yeah, I think and I think this was alluded to earlier, the intent here was not to, create more credentialware. The intent here was to actually affect change in the marketplace, and I think in that regard, we haven't really achieved what we hoped. We've made some inroads. I mean, so for instance, UCSF recently ran a digital health challenge that led to a series of awards for solutions in different categories. And part of the screening criteria for solutions that were considered under that challenge included the Xcertia Guidelines. So that's probably the most tangible instance of the Xcertia Guidelines being put to good use. But I think, and really one of the primary reasons for reaching out to Jen and the DiMe organization is a recognition that it's hard enough to get the attention, especially of developers. Push comes to shove, they're going to devote their resources to how they make money, how they drive the top line, and there's been such a proliferation of organizations that are working on standards, guidelines, best practices, whatever you choose to call them. That I think to be fair to the developer community, who do they turn to if they want to be responsible about their approach to app development. I think the same thing can be said for the clinical professional community and the consumer/patient community. Who do they turn to? And so I think to a certain extent, we dilute our efforts by not coalescing in some form or fashion to, have one reference set of guidelines that, with input from various organizations that bring in different expertise to the table. And that was one of the primary reasons, actually, for reaching out to DiMe, for reaching out to UCSF and some other entities that have become involved. We've worked closely with the Consumer Technology Association, for instance, and others. But I think that we do ourselves a disservice if we really, hope to have an impact on the marketplace, especially the developer community, if we don't start to find, a common set of things that we want to represent from, these different organizations, since each brings, certainly different expertise to the table.
Terrific, very, very helpful. Well, let's continue. Maybe I'll move to Michael Corwin. Do you want to again, tell us your reflections on some of the key learnings, key takeaways from the process?
Yeah, I mean, first of all, I think it is having a set of criteria, and these are the guidelines. So, and what strikes with after reviewing them and having the input from everybody, it's the level of notification and alerts that are provided, to users of the app, for example. I thought that was, you go through the guidelines, you see a lot of, okay, making certain that the user knows what's going on and, everything about HIPAA and privacy, you name it. But also with regard to how the app is expected to work, sort of intuitively. And so I think that, to me, is very beneficial. It has been beneficial since I've been working with organizations here recently. And so I think that's really good. And then I also do like the accuracy in the content that's required. I think that's also a very helpful thing to, and I'm looking at it mostly from the app developer side now, but before looking at it more from, okay, is this a sort of a global type of standard? And I think it could be. I think, this is really the first version of it. So, I'd like to see it continue to advance, evolve.
Terrific, terrific. Let's see, let's maybe move to Natalie, if you care to comment on the, what some of your conclusions and takeaways were from the process.
Sure. I think overall, it was a pretty successful effort within the usability work group. Like I had mentioned before, we started really from having nothing as a baseline and built up, 10 overall categories, all that contain different performance requirements, covering things from the basics like visual design and readability and understandability, and then also getting into more specific things like help resources, notifications that were also mentioned, and also including a category about how to actually evaluate your app to make sure that it does meet these usability standards. And so I think that we managed to put together a good set of usability guidelines that didn't really have any gaps as far as the major categories. And I think one of the most successful things about the process was that, we managed to do it iteratively, having regular meetings, getting continuous input, and sort of keeping things moving forward. I think that there's a lot of interest in these guidelines from the human factors community. So I've presented about the development of the usability guidelines a couple of times so far. And this is something that people are really interested in, having this universal set of guidelines, particularly for, I think, consultants, human factors consultants, which I was for a long time, having a tool that they could use to, show their clients the guidelines that it's important to meet. I think it's something that could be really valuable. Where the challenge comes in is getting people to do things that aren't regulated. So from a human factors perspective, the FDA has requirements for evaluating medical devices and combination products, but they're really only focused on products that have some sort of risk associated with them. And although some apps fall into that category, they might work with a medical device or have safety critical information in them. A lot of apps don't fall into that. So, how do we get app developers to take these guidelines into consideration if they don't exactly have to, they're not forced to from a regulatory perspective. So I think that's kind of, from a human factors perspective and looking at the usability guidelines in particular, that is maybe a next step in identifying how we can take this interest that human factors practitioners have and translate that into getting people in the industry to utilize these guidelines, to give more feedback, and to start having more of an impact on who's using them and how.
Terrific, very helpful. Yeah, very important to keep that kind of perspective in mind. And let me see, Dave. I don't think we've heard from you on this topic. Can you care to comment on what your perspective is on findings and key takeaways, key outcomes?
Sure. A couple things, Greg, just quickly, if I may, from a guidelines management. I mean, that's really, I was on a couple of the work groups. My primary role was to manage the process, if you will. And so from a process management perspective, one of the things, there's two things that we need to focus on going forward. One is to clearly define the evolution of the guidelines. It's just like when you write a 3-year or 5-year business plan, right? You sort of map out a vision for where you want the document or the business to go. I think, it would be helpful for any organization that's in this area is to determine at a broad strategic level, what are the next key evolutionary steps? Are we going to, for example, are we going to take on, what areas within the guidelines that aren't there would we want to go down and pursue? Okay, and I think to help us do that, the second thing that was a key insight for me, and we have a lot of folks that brought a lot of expertise to the table, but these guidelines are only as good as they are relevant and timely, right? This can't be a retrospective exercise. It's got to be a prospective exercise. We have to be anticipating what's going to happen in the market, a year from now, 2 years from now, from a technology perspective, from a consumer perspective, from a care perspective, and think about what that market's going to look like and make sure that the guidelines are evolving in line with where the market is going. Because in my opinion, that's the only way we're going to keep them relevant. And ultimately, to get people to buy in and use them, it's going to have to be reflective of here's what's here today. But these guidelines are also set up to be geared toward what's coming tomorrow, 6 months, a year down the road. So that, to me, I think from an overall guideline management strategy, one of the things that I think we can do better going forward is to have more of that, sort of the background of that future focus in place, so that when we do bring our work teams together, our work groups together, and our leaders together to manage the process, there's some endpoints, there's some broader market-facing endpoints that we know we need to keep in mind and drive toward. Otherwise, we will miss the mark. And that, to me, was, I think, a big takeaway from a product management perspective.
Terrific. Very, very helpful. Very helpful. Well, we're getting towards the top of the hour. Maybe we should start wrapping up around the following question, and I'll open this up to everybody. Who should these guidelines be addressed towards? Or in other words, who do you think would be the users, and what kind of individuals, what kind of stakeholders would get the most out of these types of guidelines? Anybody care to jump in?
Yeah, Greg, this is Michael. you know, I go back to some of the comments early on. I mean, there really are three audiences. Two of those audiences, obviously, are the clinical professionals that want to employ these solutions on behalf of their patients, and of course, then the patient or consumer, what stage of life they're in. Because it really, you know, is a roadmap to what they should expect. You know, what questions they should ask, you know, how they should challenge developers around these various issues. But I also think that the guidelines are a roadmap to help follow. Just they do reflect, and I think Natalie made this point very well, they do reflect, I think, what are the reasonable expectations of consumers and clinical professionals for whether, you know, whatever the topic might be, privacy, security, operability, and so forth. So I do think the guidelines can serve all the audiences, and I think that will, you know, make them sort of more universally available to the relevant stakeholders.
Excellent, excellent. Well, let's move to, you know, maybe closing thoughts. You know, any final thoughts before we turn it back over to Jen from DiMe? You know, and you know, maybe we'll continue in this theme of how should these be used, and perhaps even you know, thinking going forward. What are some of the improvements here, and what are some continued improvements that we should look for in the future?
Yeah, this is Michael Corwin, and you know, I would just like to say that, you know, possibly a really effective way to maintain the relevance of the guidelines over time is to, and this is to Dave's comment about future looking, is really look at the best of breed type of products out there. And yeah, they may not encompass everything that, you know, Xcertia has, but they may have some, you know, unique way of doing things very well. And I know there are thousands of apps, hundreds of thousands of apps, but you know, do a better job of finding and sorting through some of that and seeing what, you know, makes sense to actually you know, capture.
Terrific, terrific. Well, yeah. So you know, this is an important topic, and you know, certainly much has been learned. So we only have a couple of moments left. So let me turn it back over to DiMe and Jennifer, and before we completely run out of time.
Fantastic. Greg, Michael Hodgkins, Natalie, and Michael Corwin, thank you so much for a terrific session. Thank you also to all of our attendees who dialed in to listen and learn from you all today. There will be a recording of this and the slides available if you'd like to share this with your colleagues, along with, of course, the link to the Xcertia guidelines themselves. A quick note on what's coming down the pike for other learning opportunities here at DiMe. We have, and in fact, the website is there in the slides, and they will be provided on the DiMe website as well. Next week, we are partnering with Fierce Pharma and Amazon Web Services to bring an introduction to digital medicine. So Digital Medicine 101, that's next week, December 12th. In the new year, we have a fantastic webinar planned on machine learning, specifically as we think about sort of proactive diabetes management and care for patients. And also our next virtual journal club is the second half of January. Two of our colleagues who authored the manuscript, How Artificial Intelligence is Changing Healthcare Delivery, will participate in an Ask Me Anything session. So please go ahead, sign up for those on the website. Again, to our experts from Xcertia who led the call today, this was tremendous. Congratulations again on an excellent set of guidelines. Appreciate everyone's time. Have a great afternoon.
Thank you, Jen.
Thank you,
and thank you, Greg.
Take care. Bye-bye.
Bye-bye.